Today, we're diving into the world of Anne-Marie is a leadership coach, educator, and transformation strategist who believes it's time for a new way of leading, especially in health systems. Her work centers on embracing complexity, fostering collaboration, and creating space for clarity, courage, and purpose. With over 2 decades of cross-sector experience in the public, private, and not-for-profit worlds, Anne-Marie helps individuals and organizations navigate uncertainty, untangle complexity, and co-create more regenerative ways of working without burning out or losing sight of what matters most. Her approach blends systems thinking, change leadership, and deep human connection. She's trained in change management, holds a black belt in lean healthcare, and is certified in systems coaching, ORSC, and flow-based leadership. Anne-Marie also teaches at the Telfer School of Management and recently took the TEDx stage to share her insights on systemic leadership. Whether she's coaching gifted professionals, designing culture-shifting programs, or facilitating multi-stakeholder collaborations, Anne-Marie is known for meeting people where they are and helping them lead with integrity, clarity, and flow.
Welcome back to Uncharted Narratives. If you're just joining us, we're continuing our second-part conversation. Now let's continue our journey and uncover more remarkable stories and insights.
Yeah, and if we connect the two together, when we start, we say the change management, it's very important and need to have those people. And when we need to do the change across the country, this is what take longer time than it will take in the hospital. We know in the hospital take years. How if we want to change in the country? And when you hear and listen for the feedback came from different perspective, from different background, and from your student, I will say from my experience, from where I came from different country, but I compare with Jordan. Jordan considered a poor country.
Okay.
Canada considered one of the G7 country. The healthcare system in Jordan much better than in Canada. When I came, I cannot understand how come the investment from the government, Canadian government, is like pennies in Jordan, and the healthcare system is better. So I think the way how they need to work, the kind of change is need to advocate, have collective team working together and speak up. And I like it when you mention speak up, and this is where the politician will be forced to make the change. And if we don't, we will take the side effect from this, because right now it is not secret. Everyone know how much the healthcare system they are leaving, the professional they are leaving, and they are burdened. And there is a huge number of study and statistic how this impact their health. And when they are leaving, we are left out with no resource. So it is bigger issue. So when you advocating for the healthcare system, or doctor or physician or nurses, not because you need to do business or you have, this is if you don't need it right now, 5-10 years you will need it, and you will find there is no resource for you, as you mentioned. Later on, it's too late to make any change. What's your advice for who is already working in the healthcare system to speak up and try to make the change? How they can make the change and speak up?
Yeah. So this is part of, I don't know if I'm answering your question correctly, but I know sometimes when I post on LinkedIn or I'll put an idea out there, right? People will go, that's it, just keep going. And I'm like, no, you join in. It's not just me. You also share your message here. So you have a leadership role. You have energy and things to play. And I'm not a formal leader in the health system advancing things. I'm like anybody else activating a conversation so that we can have that same picture. And I wonder if part of why Canada might be seen as behind now is because there was this collective belief that we had the best system in the world.
Yeah.
So then there's a bit of like, well, do we need to invest in it? Do we need to change? But then as it slowly started to change, and I think part of it is, there maybe back then people didn't have as much chronic disease or complex care needs. So the system maybe was okay before. But now with the population that's growing older, that has more chronic disease, more complex care needs, that's where we really saw that the system was not working for that situation. It's fine if you just have a quick issue and you need to go see your family doctor. They give you a prescription or they tell you what to do and you're gone. But as soon as you need to interact with the other parts of the system, that's where it doesn't work as well anymore. Unless you're in a particular region where a lot of people have done a lot of great work to design a particular program for patients with cancer, for example, or patients with diabetes, and then they spend time integrating the system in their region. But so I think that's why it might have taken more time to go, wait a minute, we're not connected. And we've designed all these silos and how the system is financed where people didn't start to work together. But I don't know, Anas, if you saw recently, the city, I think of Aurelia, has just announced that they will set up a clinic. They will pay the physician. They'll get reimbursed by OHIP for that physician's time. But I was like, wow, that's a very different way of seeing healthcare being delivered. And I think that city must have seen we have a problem with primary care in our community. What could we do to change it? And so you would say, wait a minute, healthcare is not a municipal thing. What are they doing? And so I think that's an interesting conversation there because we've broken the barrier of, well, maybe municipalities can start playing a role in healthcare. They're doing it when it comes to public health. So why is public health and primary care so
you're
separate?
right. Yeah, I never thought about it. Yeah. Why public health with the municipality and the hospital with the ministry or following the ministry?
And it's just because the system was not designed with a perfect design in mind, right? It kind of evolved this way. But I find that example of the city of Aurelia a really interesting one to have a step back and go, well, wait a minute. That's an interesting idea. Well, what does that mean now in terms of the taxpayers in that city? You know, are they paying more for healthcare than other cities? Is it going to help them? I don't know what's going to be the model. I don't have a lot of details.
Yeah, but at least there's a new idea. They want to test it and validate it.
That's what we need. So here's another concept from systems is you can't, and complexity kind of sciences, is you'll never be able to change a system by directly going at it and poking at it and trying to change it. Sometimes when things are broken, you almost have to design something new that makes the old system become irrelevant. And so I think what we need to improve the system we have, it's too hard to go in a system that's like, well in its way and have a momentum. But it's about these little innovations, these sparks that might make the system go, wait a minute. And then the system will start adjusting in a different way when we have these new innovations. That's how these larger kind of scale change happen.
Like when you go for your house and you want to re-innovate the house, you will not re-innovate the house, all of them over the night. Gradually, you will see something in you in the house is not integrated or connected with the old house. Doesn't make any sense. But after the time, all of them, they will, like a puzzle, you connect them exactly how you put it here. So if I have an idea, I work in the system, and I want to test the idea. I'm not saying my idea is the right things, okay? And I start with the idea, try to put the business plan, try to understand how we can integrate it with the system and what is the return of investment for the healthcare system. I want to start from where I want to start.
The best way to start is to start engaging others in a conversation and you seeing your idea as almost an offering, because your idea comes from, but then if you offer it and then people add to the idea, then the idea starts taking shape with perspectives and other stories that other people might have, because your perspective will be just a seed, but it needs all these other energies around it, and it's still limited. So I think for me, the best place to start is start talking with others, inviting others into the conversation, and always asking people, who else might be interested in this? Who else do you think I should talk to that this connects with what they're trying to do? And then setting up that space for people to explore. I would love to know how the concept in the city of Aurelia started, for example. And some of these innovations just work that way. Like, for example, in Ontario, there's CHEO and there's Sick Kids, the two standalone pediatric hospitals in the province, right? And there are other pediatric centers in the province, but not every community has a pediatric center or pediatric expertise. And so they were noticing that in some cases, they were getting patients who had to travel very far away to get to their hospital. And someone just said, this doesn't make any sense, that they have to travel 4 or 5 hours to come and see us. So what is it that we could do or change things differently? And together, Sick Kids and CHEO created this thing called, I think it's a Kids Health Alliance. And what they do is they create, and I might have that name wrong, I should have checked it up before, but they create all these resources, and then they make sure that there's support from Sick Kids and CHEO to help other doctors in other hospitals treating a pediatric patient, for example. And so they didn't have to. They could have just said, let's just work within our box. But they noticed a problem with the clientele that came, and somebody in those organizations said, hey, wait a minute, we can do something different. And I don't know if it was CHEO or Sick Kid that initiated, but they said we would be more powerful if we did it together.
I don't know that. This is the first time I know that. But immediately I realized this is why it happened. Maybe I'm mistaken, because they are independent. They have the power. They are empowered hospital. They can make the change freely. They can bring the idea, and they try to test it, validate it without the bureaucracy in the system. That make them to look like they are role model. But here, back for the question where I ask you, I know it is a true story where nurses, they came with the idea, work together with different stakeholders, with disciplinary team, and the idea now, they believe it's good to start.
Okay.
Okay. When they presented for their hospital, they told them, we don't have the power to implement it. It's not in our responsibility. It's beyond our role. So when they started to go beyond the hospital, they stuck with the system.
Yep. So here would be my advice there, because that happens a lot, right? We're like, oh, there's these walls, there's these silos. We can't break those. We must work within the system. So I think there you need a different kind of conversation. And questions are a powerful tool. So sometimes you could ask questions like, what would need to change then to make this possible? Or what role, understanding that we don't have all the control or all the power to change this, what's the part that we play in changing this? So it doesn't have to be for the whole thing. And then, well, who else could partner with us to make this happen if it's not just us? So I think sometimes, and that's the difference between when people are in the system and they've been ingrained that the system works this way and it's a machine and you can't change it. But if you see that the system is more like a forest where everything is continuously changing, evolving, and adapting, then you can ask different questions, like which part of the forest could help us here or benefit, or what's going to change after we do some of these things. So I think it's a different way of seeing, and it is a lot of hard work. So I don't want to diminish like asking these questions, asking the right people. But what I think is these questions can help change how we're seeing the problem, change and see what's possible. And so maybe you have this great idea, but then you need to fit that great idea in the realities of the current system by asking different questions and having people think differently. And this can take a lot of time. And the other thing that I've also noticed does not work really well is telling other people, I see this problem, this is the solution, we should go there. People need to be brought on that journey. Do we agree that this is a problem? And so the example I gave you with the Kids Health Alliance, do we agree it's a problem that these children need to travel all these hours for services that really don't need their specialty? But it's just because that they don't have those knowledge in their community or their area. How could we solve that? And they could have said, not our problem. That's in the other hospitals. But somebody decided to think outside the barriers of the system. And so I think it is the same thing for this passionate group of nurses who has an idea. And it's not to stop at the first no, because the system is designed to want to retain how it's working right now.
Unfortunately, the system is built to make those people who have the innovative idea to become for the people or the group who say it's not my business, it's not my problem. So here where they stuck, because they stuck with different barriers, hurdles, they try to make those change. And there's a lot of negotiation skills.
Absolutely.
A lot of politics, communication skills, and not necessarily I have all of those. Even for me, I work for a regular job. I'm expecting my leadership, they will welcoming me and try to facilitate how to make this fit or how to encourage me to think more about how to enhance it or improve it. It's not my job to go and make all those change. You see, I said it's not my job, because if I work 12 hours and we are out of resource, okay, and I work overtime, when I will sit and be creative to think, how to bring a new.
I know. And that's part of the challenges in the current system we're seeing. I don't know if you've ever seen this image on us. I bring it up a lot. It's these cavemen that are pushing this wheelbarrow, but the wheelbarrow has these square wheels.
Yeah.
And they're pushing it into like this mud, right? And you see they're working really hard. And then there's somebody behind with a round wheel who says, hey, I have an idea. And then the guys pushing the wheelbarrow, like, we're too busy. And so we're kind of stuck in a system that's using a lot of resources and don't even have the time to say, wait, let's pause. Wait a minute. What is your
However,
idea? And if we put that wheel on, we'll save time.
it is a cliche and it is a very famous picture and everyone know it. And every time we see it, we believe in this picture, it is the right things. Who is in the system, they don't see the problem. The one who out of the system, they see the problem. And sometimes they know how to solve it very quickly. And they thought they don't have time. They keep doing the same wrong and the same mistake. And they don't want to invest to make their life easier.
Yeah.
When you see the picture, it's silly. It's very simple.
Know.
You know that. But when you go and make the change, it's very difficult. Thank you to bring it. Yeah, this is very, very good example.
It's always, sometimes in hindsight, it's always easier. And again, I think that's obviously a square wheel versus a round wheel is an easy one to see the connection, right? And the problems we face in healthcare are more challenging than replacing a square wheel with a round wheel. But maybe the example of that is investing more in primary care, as an example, will reduce pressure on hospitals. And hospitals are working a lot on improving the efficiency within the hospital and spending a lot of time with lean or with other tools around continuous improvement, but maybe helping the hospitals be sustainable. We need solutions outside the hospital, not from within the hospital. And so I think what it does take a lot of courageous people, and I'll call them leaders, who are willing to push for those conversations and asking the right question. And I love this question of what would need to change to make this possible? What would need to change to make this work? And
our mindset.
Yeah.
Our mindset.
It's our mind. Well, it is our mindset. But then when you ask those questions, and then if you can get people to agree to the same goal and what are other ways we could do this, it could just help. But yeah, I think
there is something. Okay, I will give you an example. All of leadership and anyone in the hospital in any country, this is not in Canada, they know nursing shortage, it's a real problem, and they living on in speed is where the demand more than the supply.
Yeah.
So all of them, they know that since a long time, but all the solution is not touching the root of the issue. This is where we see a lot of effort, a lot of investment, but it's not touching the area.
There are three different types of problems. And the first one would be like a simple problem. And a simple problem, they're very clear to see. Everybody can easily see the cause and effect relationship and agree on that's the best thing we can do right now. So an example of that is like the wheelbarrow image I shared with you earlier. Everybody would see that if you replace the square wheel by a round wheel, the wheelbarrow will go faster. Then you have a complicated problem. And a complicated problem, there's a lot of cause and effects that you need to manage and maintain together to address these issues. And examples of that could be performing surgery, for example, or sending a rocket into space. And those problems, usually, if you get the right experts, they understand all those cause and effect relationships and they can address them. And in those, they'll often come up with what is a good solution here, given that there's a lot of different options that we can do to address the problem. And then the last types of problems are complex problems. And those, there's not really cause and effect relationship. There's things are influencing, interacting, but you can't really pinpoint, if I change this, did that cause that? And maybe the easiest way to explain that in us is like children. If you have two children, even if you raise them the same way, they don't respond to the instructions in the same manner. They don't develop.
I can't.
So I think when it's complex problems, there are no root causes. There's just multiple contributing factors to the complexity of the issue. So what you need to look at is, well, where could we navigate, put pressure, have the system change? And you might not ever be able to completely solve a complex problem, but if at least you get it to move towards a direction where it's not causing as much harm, then you're in a better place than where you used to be. So when it comes to nurses that are burning out, there's so many factors, and it would be really hard to pinpoint which ones are having the most impact And for sure, those are the root causes. If we address those, we're going to solve the problem. Because maybe at a certain point in time, it might be a particular factor. But maybe over time, you say, okay, we address that factor. And then 5 years later, you still have a nurse burnout issue. Something else emerged. Something else showed up. So in complex systems that way, you try to look at what those contributing factors are, try to influence them. But the system's always going to need that attention, that care.
Change, and those consider as a cofactor. Anne-Marie, I like how you put it here. How we can recommend you to be our minister?
No, I do not want to go into politics.
Really, I like the way how you think about it, and also the concept. And this is the value for having non-clinical working on the system and try to find solution.
And do you want to know? I'll share this with you about my experience. So what I've noticed is when you talk about complex problems, people will shut down. It's too much to process. There's a lot of things, and people want quick wins. People want to fix the low-hanging fruits, because then I can say, tick, I've done something. But it's not enough. And so what I try to do is create these spaces where people can believe, can see, and say, this is the new way we need to work. This is part of addressing complex problems. This is normal. There's no, you do this, you follow the process, problem solved. But I understand that it feels really overwhelming.
Yeah, and I agree. Sorry, I don't want to jump in here, but it's resonate a lot with me. And here, whereas the leadership will take the bigger image and they put it as a small pieces, and each small pieces, every team they were working that. Then after that, we'll take this and connect it the picture together. Because if we take the big piece, try to solve it, we will not solve it. Everyone will sit down, as you mentioned. So we need to start gradually, step by step, and see how they will connect later together. And maybe this change will make another issue. So we need to be aware and expecting. We are ready for any change or side effect to be aware about it, but not to be naive. This will work immediately and just plug in, and we are here.
And I don't know if you've heard, there's also kind of another comparison that I enjoy. Is like there's two types of problems, right? That people will say to you is like there's clock problems, and then there are cloud problems. And so if you think it's a clock problem, you can break the clock in all its parts, fix the parts, and put it back together. But then we're talking about either simple or complicated. A complex problem could be more like a cloud. You can't go fix a part of the cloud. And then the wind, the sun, all these things, the cloud keeps changing and moving and evolving at the same time. So what we need for leaders working the systems is not, let's try to break the cloud apart, understand how it works, and then put it back together. But that's often how we approach these issues. We just need to understand that the cloud moves in certain patterns. There's so many different factors affecting it. And then we experiment and see, well, did that shift the cloud? Did that shift the cloud? Now, where is the cloud? What else do we need to do? So it's a different way of looking at a problem that you might not always fully understand what the factors are at play, but you can see what's emerging, what's moving, and whether or not your actions are bringing it to the better direction.
But we are aiming, we are in the right side, and we are aiming, we are doing the right thing. But right now, majority of us, we know, and we claim we are in the wrong side. This is the issue. This is the issue. Maybe we do something now, we believe it's the right thing, but later on we discover it's wrong.
Yeah, that's possible.
Yeah, but now, majority, we agree we are in the wrong side, and we keep doing what we are doing.
I know. That's crazy. It's like what Einstein says, right? Doing the same thing and expecting a different result is the definition of insanity. And you know, the example you just gave, let's say that it did work for a moment, but now it's no longer working. It doesn't mean that we failed. It worked for that period. But now things have changed. People have evolved. So we need to do something else now. That's the work. That's the challenge that we have.
Otherwise, we don't have electricity. We don't have all those technology. If we have the same mindset, I don't know what's going on. How you see the healthcare and technology and trends. What you expecting to be the emerging trend within 5-10 years?
I think there's going to need to be more people to understand some of these concepts. And there is. So I recently went to an event where this doctor was like, oh, I've learned about system thinking and complexity science. And here, I'll explain it to you. And I was like, great. And I think we need to understand these different ways of looking at systems to be comfortable with the uncertainty that we don't always have all the answers or the detail, and that the system is always evolving and changing. And so what I do suspect, because when I teach some of these principles to the next generation of leaders, they understand it, right? But that's in a different context. I'm the professor, so they listen. But out there, kind of in organizations, you can't use these words or these concepts because in a structure, like it's not what people are used to talking about or focusing
More
on.
corporate language, business language.
Right. And then we want to, so I think as we start embracing these, seeing examples of people adopting it, seeing that be successful. And I think another challenge enough that we have in healthcare is the way that we've evolved medicine, right? Which has always been based on evidence. And then there's that hierarchy of evidence, right? Like anecdotal, we start observing, and then you get to the systematic reviews and meta-analysis, and then we know that is good, solid evidence. But when you're working in a system that's always emerging and changing and shifting, you'll never get 100% evidence for doing something. And so sometimes I wonder if part of the issue in the health system is that we've been so trained and conditioned to think about where's the evidence? Who else has done something? But then maybe something worked in another country and we bring it to Canada and we try to do it in Canada, but it didn't work. Well, no, because it was a completely different context. That other country had maybe a different social system, had a different education system, had a different context.
But maybe it's work, but maybe it's work. Again, maybe not, maybe yes. We don't know.
Exactly.
There's a lot of successful story where where in other country, when they bring it doesn't work, and the other day they work. I came from that country where they see their experience and they localize it for them. They don't take it as is.
Exactly. And that's recognizing what's different about that country that we need to adjust in ours, and will it work, and having those conversations. Yes. Context matters.
Yeah. Anne-Marie, thank you for your time. We can keep going. Nothing can stop us. I appreciate your time, and I will leave it for you. How do you want to end the podcast for today?
No, well, thank you, Anas. It's been such a pleasure chatting with you. And then if folks are still interested, I'd love you to watch my TED Talk on how do we restore the system in the health system. So thank you.
Yeah, for sure. I will take the link from you and I will put it on the description. So thank you for your time, and hopefully I bring you again with good story and good initiative to tell us about it, what's going on in the country. Thank you.
That would be great. Thank you.
Bye.
Bye.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Surdiyat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Surdiyat.